Now, Dr. Nasr Mohamed, he was talking about the effect of bony cochlear nerve canal with on the degree of sensorineural hearing loss and cochlear implant outcome.
Bismillah ar-Rahman ar-Rahim. Dear Professor, attendant, and our colleague. My presentation is about the effect of bony cochlear nerve canal diameter on the degree of sensorineural hearing loss. The bony cochlear nerve canal lie between the base of the cochlea and the fundus of the internal auditory canal, and increase the cochlear nerve fiber from the cochlea to the spiral ganglion. If the length of the bony cochlear nerve canal is less than 1.4 in axial plane, then the cochlear nerve may be abnormal. The narrowing of the bony cochlear nerve canal indicates functional or anatomical disorder in cochlear nerve. The bony cochlear nerve canal may be normal, hypoplastic, absent. The study aimed to assess the effect of bony cochlear nerve canal on the degree of sensorineural hearing loss. This information may be helpful in predicting improvement in speech performance after cochlear implant. A retrospective study approved by ethical committee, a total of 50 patients with sensorineural hearing loss, chosen from those attending the outpatient ANT of Bony University Hospital from November 2020 to June 2022. After taking a history and clinical assessment, including full ENT examination and pure tone audiometry, then referred to audiological department. The inclusion criteria include patient complaining of sensorineural hearing loss, patient with audiometry supporting finding of sensorineural hearing loss, patient of age less than 18 years old, school age. The exclusion criteria include general contraindication to MRI, patient of age more than 18 years old, patient with conductive hearing loss, patient with cochlear implantation, those with history of trauma, infection, or ear surgery. All patients were subjected to full history taking, complete ENT examination, audiological evaluation, imaging procedure, including all patients underwent multi-slice CT pedal spoon and the MRI of the internal auditory canal. Two parameters used to analyze the correlation between the bony cochlear nerve canal and the degree of sensorineural hearing loss: the bony cochlear nerve canal width and the status of the cochlear nerve. The bony cochlear nerve canal width was estimated using the axial plane of the petrous bone. The width of the bony cochlear nerve canal measured at its mid portion and defined as the distance between the inner margin of the bony wall. The status of the cochlear nerve detected by MRI internal auditory canal. This axial CT showing the bony cochlear nerve and axial MRI drive-in showing the cochlear nerve, and sagittal MRI showing the facial, superior vestibular, inferior vestibular, and the cochlear, and the C showing that the cochlear nerve is absent. The width of the bony cochlear nerve at the fundus of the internal auditory canal measured in millimeter by drawing a perpendicular line from the base of the modulus to the inner margin of the fundus of the internal auditory canal. The width of the canal obtained at its midpoint. Axial CT showing the normal bony cochlear nerve canal, and the B showing the narrowed bony cochlear nerve canal associated with large vestibular aqueduct. The status of the cochlear nerve evaluated at the lateral part of the internal auditory canal using sagittal oblique of the internal auditory canal. At this site, the facial and the cochlear nerve are similar size and larger than the vestibular nerve. By chart showing that the CT width of the bony cochlear nerve canal, we divide the study into three groups. Group 1, less than 1.4, including 69 year, presenting 69%. Group 2, 1.4 to 2, representing 27%. And group 3, including more than 2 millimeter, including 4 years. The mean chart of the audiometry at each threshold. Pie chart of the degree of pure tone audiometry dividing this group into, according to the presentation, to moderate, severe, and profound. 1 year presented with moderate sensorineural hearing loss, 18 presented with moderate sensorineural hearing loss, 30 years presented with severe sensorineural hearing loss, and 51 presented with profound sensorineural hearing loss. This is a histogram of distribution of CT and the pure tone audiometry, showing a significant difference was observed in the mean level of all pure tone threshold in group 1 compared to group 2. And this is a histogram of distribution of CT and the pure tone averaging finding in 15 patients with sensorineural hearing loss. There was significant difference in the mean level of pure tone averaging in group 1 compared to the group 2. Histogram of the relation between the bony cochlear nerve canal stenosis and the canal hypoplasia and aplasia. There was significant difference in group 1 of bony canal stenosis diameter in CT less than 1.4 compared to the other group. Case number 1, 9 years child presented with bilateral sensorineural hearing loss, axial CT of the right and the left, showing that the bony canal diameter is normal, 2.1 at the right and 2 millimeter at the left. And this is the axial drive-in, 3D drive-in of the inner ear, and sagittal oblique, showing that the cochlear nerve is normal compared to the facial. And this is the audiogram of this patient. Another case, 14 years old child presented with sensorineural hearing loss, showing that the bony canal at the right measuring 0.8 and at the left 0.8 associated with large vestibular aqueduct, and the axial drive-in MRI and the sagittal oblique showing that the cochlear nerve is hypoplastic. And this is the audiogram of this patient. Another third case, 10 years old child presented with sensorineural hearing loss. The bony canal at the right diameter 1 millimeter and at the left 0.5. And this is the axial and the coronal MRI showing that the cochlear nerve is normal at the right and is absent at the left side. Bony cochlear nerve stenosis, there is a high probability to cochlear nerve aplasia or hypoplasia. The bony cochlear canal stenosis with a diameter less than 1.4 indicates that the cochlear nerve aplasia or hypoplasia. All cases except severe to profound sensorineural hearing loss. Children with bony cochlear nerve canal diameter more than 1.4 millimeter, cochlear nerve hypoplasia was not observed. Thank you.
Thank you, Dr. Nasr. Any questions?
Yes,